We're right at the end of Nurses Week, so I think technically ended 2 days ago, but we're right within distance of it. But anyway, nurses, the heart of healthcare, and we've got a celebratory event tonight to really honor some unique and incredible individuals, and I'm excited that we're all here. That being said, it's kind of crazy. About 2 years ago, right now is when I moved to Twin Falls, and I think it was my first week, and I was asked to step up. We were having a nurses celebratory event that week as well, back in May. And I was asked, show up, dress up nice, get up and smile, and that's what you'll need to do. And this year, I've got a little more of a role to play. And kind of looking back, this is something that we want to acknowledge every year. And nurses are incredibly important to our community, the support, the care that they give and provide to the families, the individuals, is really something to celebrate on an annual basis. That being said, last year, things changed and we weren't able to host this event last year. We started the process engaging the community, but as we know, the world changed around us. And that being said, I'm excited that we do have a crowd, little crowd here in person tonight. We were just kind of talking about it that, thinking back even probably 2 months ago, it was like, do we do anything in person? How do we come together? And we have this great facility and we've planned for no more than 50 people. So that's part of the process that we've gone through is events look different. And we've got a nice blend of live to where we can get folks here together. It's clear to see that people still want to be together and not spread out all over the place. I think we're ready to come back. Just great timing that we could have had a whole crowd here tonight, but I'm glad that those of you that are out here were able to make it. So that being said, kind of getting into nurses and really the heart of why we're here. And as a news publisher, looking back at again the last year, it's incredible how so much has gone on in this world, and nursing and medical, the medical profession as a whole has been caught in the epicenter and the crossfire of a lot of things going on in our world. And all throughout it, you're inside and you're seeing a whole different world, and we're kind of on the outside looking in and trying to tell those stories. So I'm really excited to kind of get in and see and hear what's happened on the inside, over the last year, because we've only been looking through the window. So certainly hope to get through that tonight. Moving on, kind of want to talk about how we brought all this together. So certainly we wouldn't be here tonight without the great community sponsors that have supported us through this endeavor. We started the process back in February, and right off the bat, St. Luke's and CSI said, yep, sign us up. We're all about this. We're great timing, great opportunity to give back to our community, kind of allow some individuals to be recognized this evening. And then we went in and got great additional sponsors as well. So Con Paulo stepped up as a sponsor as well. I know when Con was presented, hey, we want to sponsor this nursing event, he said, that's right up our alley. That's exactly what we want our brand aligned with. And I know everybody that else was as well. We have Threads, they're gift bag sponsors, so they provided the great gift bags this evening that are full of some treats for each of you all tonight. Kind of going back through the process, kind of what that looks like is the Times News and MagicValley.com. We have a great local audience, a great engaged audience. We're able to connect and reach out and start dialogue and get feedback from the community as a whole. So what this process looks like is again, going back in February, we asked the entire community to step up and say, okay, who are the nurses that we want to recognize? And this is coming from individuals. It's anybody in the community. Who do we want to recognize for something that we know they're in a challenging and rewarding profession, but they go above and beyond and go the extra mile. So it really is a community opportunity to acknowledge anyone that they feel should be recognized ultimately at tonight's event. So kind of going through that process, let's look at the individuals that were selected this year. So I believe the total, I have 31 here. I don't know if that's the number up there, but I believe we had a great showing across the community of folks saying, hey, here's who we want to be considered for this recognition this evening. It's a great process. We get a lot of feedback, some great compliments and statements that are shared from the community at large. And we go through a process where, first off, we send it out, and after the nominations are in place, we ask the community again to say, okay, out of what you see, who's somebody that we should choose tonight that's recognized from the community at whole. They just got behind that individual, the nomination, and we have a Reader's Choice awardee tonight. The rest, there's 9 additional honorees that are selected through a judging panel. We couldn't have done this without them, so I want to thank Linda Montgomery, the chair of South Central Public Health District Board of Health. I also want to thank Christy Clark, the Quality Director and Interim Chief Nursing Officer with Minidoka Memorial Hospital, and Christy Boyd, Chief Nursing Officer, North Canyon Medical Center. So again, after weeks of getting the nominations and going through that process, these judges helped us, obviously from a standpoint within the profession, to look and say, here are the honorees out of the total selection, and that's why you're here this evening. So kind of looking at to kind of get us kicked off into the program, and I'll take a pause from my introduction and kind of getting us kicked off. When I partnered with St. Luke's and CSI, we've got tremendous teams here. So Kimberly and Matt with CSI and the rest of the team, Michelle and Tori and others with St. Luke's, we kind of got together and said, hey, how do we bring more to the table and tell more of what's going on from the perspective, again, within. And so we're going to watch some slides and videos to kind of go through that. So the first one that'll kick us off tonight, when we kind of talk about that outside looking in and looking through the window, of course, we've got our chief photographer, Drew, that's here tonight, and we'll watch a slideshow that he put together of what he saw just within the last year of kind of how health in general and COVID looked from a community perspective. Thanks, Drew. I'll just get you guys teed up for the next two videos, kind of looking ahead. And again, as we go to tell the stories from within, I want to thank St. Luke's for the following two stories that we'll hear. So we'll check those out. Thank you.
So COVID has drastically changed the way that we nurse in the ICU. We changed our protocols every day. We changed our policies every day. Watching patients die without their family has probably been one of the hardest experiences in my career. I remember last March taking care of one of the first COVID deaths. I remember walking into the COVID room. It was the first COVID patient I had taken care of. And you have all your gear on, you have this gown and you have this mask and you have goggles and all the doors are closed, which is not something that we often do in the ICU. And I remember walking in for my morning assessment with the respiratory therapist, and he finished before I was done with my assessment, and he asked me if I needed anything, and then he left. And I remember the door closing and just feeling so alone. I'm in a room with a patient who has a virus that we at this time know nothing about. We have no idea what we're treating. And all I can hear is the sound of the ventilator. And I'm hoping that I put my mask on right. That I'm doing everything that I'm supposed to be doing. I took care of this patient for 3 days before we finally withdrew support. And I held my own phone in front of this patient so that his partner of 20 years could see him as he died. And it was awful. And that's what we dealt with for months, using our own electronic devices to ensure that our patients could see their families. And these were patients, some of these patients didn't even have COVID, but we couldn't get their families into the hospital. Nursing without families is like trying to make cookies without flour. It doesn't work. It's hard. They provide some level of healing that I don't think we were aware of prior to this.
I still remember, I believe it was March 16th when we ended up having our first COVID patient, and just the overall fear that everyone had. The workload was unimaginable. We didn't understand all of the care that was going to go into taking care of these patients, the complete isolation. So we had to be that kind of family for them. And I don't know, it was a really difficult time because there were a lot of people that didn't have family and friends there, and we were the last ones that they ended up seeing, and we got very, very close with them and things like that. So it was really hard, and I'm totally fine with being emotional talking about this because everybody was. We were there for the entire year. People have worked 10, 11, 12, 13 days in a row. And it was really, really difficult, and we could not have done it if we didn't have the team that we did, and we could not have achieved that if we didn't have the management that we did. And I feel that we couldn't have really done it the best we could have in another health system, because I just remember people coming to us and they're like, what do you guys need? We need N95s. We will get them for you. And I just remember always watching on the TV of people we don't have enough N95s. We're wearing the same ones for a week. We had all of the equipment that we possibly needed. We were so well supported by just the entire health system and everyone involved, and that really brought us a lot together, and that we really supported each other, and we're like, hey, you got to go take a break. Like, I'm going to watch your people. You got to go get a walk outside. Like, we got this. I'm very glad that I went through this experience at St. Luke's. We did not furlough any of our people. We supported them. When it came down to the pandemic, they were like, no, this is about people. And we're going to support our people, and we're going to help them get through this, and we're just going to try to get back on track.
I think we can give a round of applause for the folks that spoke on that. I think one of the things when I was speaking with the ladies that are on the stage tonight about talking up here, it takes a lot to get up and share those types of stories. And so for those individuals to do that and tell the stories from within, really what the last year looked like, that takes a lot of courage, and I'm glad that we were able to hear what they saw and what they experienced over the last year. And I know each of you have those stories that you also have, and have probably shared those with your family. As we kind of continue to look at the connections and the importance of nursing and understanding the role and the experiences. And again, with our great partnership with St. Luke's, there's nobody better to help tell us a little bit more that can kind of explain and kind of discuss, what he's seen within our community, within the healthcare community and organization. And so I'm honored and thankful tonight to welcome the Chief Operating Officer and Chief Nursing Officer, of St. Luke's Magic Valley Medical Center and St. Luke's Jerome Hospital, Dr. Arlen Bayleigh. So thank you.
Thanks, everybody. Thanks, Matt, for the opportunity to speak to this distinguished group. And it's going to be a little weird because I'm kind of looking that way and I'm talking about you. So please forgive me if I'm not looking directly at you. But I want to say congratulations to each and every one of you and the organizations that you work for. You're some of the bright spots from this past year. And you will hear us say it over and over, but I want you to hear me say thank you for all that you've given to our patients and to our communities. And you're caring, strong, you're educated, you're exceptional professionals who lead with excellency, and you lead by example. So I'm honored to stand here before you and talk. So my apology if I'm not looking directly at you. Let me start with a prediction. The prediction is pretty obvious. Healthcare will never be the same again. Much like how the air travel was changed by terrorist events in September 11th, 2001, COVID-19 will prove to be the watershed moment in history where all of healthcare, I believe, was changed forever. Those of us who were talking about telehealth got it in gear for real once COVID showed up. It showed us that employees can work from almost anywhere, not just from inside expensive brick and mortar facilities. It taught former competitors how to lay down their personal agendas and work together. We actually found out that the real enemy in healthcare is that virus that's affecting our friends and our family and our neighbors. It's not the organizations with a differing logo down the street. It highlighted the risk of allowing politics into patient care and putting all of our supply chain eggs in one basket. It showed us the gaps in our theories. It showed us the lapse in our infection prevention practices. And it'll end up killing nearly 500 million people before we finally get this in control. So whether we like it or not, one small lingering crown-shaped virus has forever changed us and will continue to reshape the world and how we care for the sick. As Matt mentioned and others, COVID rudely introduced itself to Idaho in March of 2020. Within a few weeks, St. Luke's had to close admissions at one of its critical access hospitals in Wood River. because between 100 and 140 staff were either infected or exposed to the virus. Because of our organizational structure and our proximity to Wood River, St. Luke's Magic Valley shouldered most of the clinical burden from this first wave. Our ICU usually sees 6 patients in the ICU in any given day. We were up to 14 on a ventilator, not including all the other ICU patients. And so that was quite a big jump. And our team rallied, our whole hospital rallied, and our community rallied. And COVID was a gift that just kept on giving. Idaho has endured 2 additional waves of infected people since that time. Each one was larger than the previous one, nearly overwhelming all of our healthcare facilities. And just so you know, to date, Idaho has recorded 8,200 hospitalizations and over 2,000 deaths related to COVID. Johns Hopkins has reported that this pandemic has caused 3.3 million deaths across the world. 580,000 right here in this United States. And I'm sorry to say that one of them that I remember the most was my dear beloved 86-year-old father named Robert, who died of COVID. And while things are better in the United States, by the way, I only had 2 in our hospital today. At one time, I had 75. While things are better here in the United States, this fight is not over. Variants could very well cause another wave of illness across our country. India, by the way, in case you're reading any of the news, is being decimated right now. Its neighboring Nepal has reported last weekend infection rates of 47%. That's 1 out of 2 that they've tested. And over the past few weeks in our world, COVID has killed on an average of 120 people per hour. That's 2 a minute. And so by the time I get done, 20 to 25 people will have died. Let me add a second prediction. No matter what virus, plague, political regime, war, national disaster, or unprecedented calamity, no matter what threatens the health of any people anywhere in the world, nurses will be at the forefront of caring for and healing the sick. It's a calling. For those of you who don't know, it's a calling. It's in our blood. It's a profession. We don't know the word retreat when our patient truly needs us. Quitting because it's hard, quitting because it's difficult or complicated or frightening is not in our nature. We are here to stand in a gap for those less fortunate and humbly serve the sick and injured, no matter their race, their color, their sexual orientation, their political affiliation, or their nation of origin. And how do I know this? Well, it's in our history, from Florence Nightingale to the Navy Nurse Corps to the American Red Cross to the many, many Catholic charities that started most of our U.S. hospitals. And I saw it again in many of you through your actions and passion during this current pandemic. When others stepped back out of fear of an unknown contagious disease, you stepped forward, not because you weren't afraid, but because, as I stated before, you didn't know how to retreat when a patient needed you. I've seen and heard stories of how you braved the cold to swab a stranger's nares. You reused PPE. You applied and reapplied lotions and creams to your irritated face from your mask. You created various gadgets to keep the pressure ulcers off of your ears. You gave discharge instructions in parking lots. You ate alone. You stayed in hotels away from family, friends, just so that you could have the privilege to care for someone who may or may not have heeded your advice on masking, hand washing, and physical distancing. You talked to them. You read to them. I saw people singing to them. I saw videos of people even dancing before their patients to try to raise their spirits. You mastered this thing called a virtual birthday. You FaceTime families with and for your patients because of our strict visitation policies. You shared final wishes to absentee loved ones. And I know you snuck an extra 1 or 2 visitors in to help the terminal not die alone. I know you thought I didn't see this, but we did, and it's okay. I've seen you take ICU patients outside for one final glimpse of the sun and breath of fresh air, only to realize that this activity often renewed life and hope in these individuals, and it jump-started their recovery. You've helped feeble bodies to windows just so they could see the glimpse of family and friends waving banners and balloons down on the grounds below. And one of my favorite stories was about a senior citizen who had a stroke, not COVID, but he had a stroke during all this time when we had everything locked down. And we were honestly learning how to handle these new challenges, and to be honest, our visitation policy didn't quite handle this very good. We didn't do a very good job of communicating with our families. And this man's wife didn't know what was going on, so she started writing him a letter every day. And every letter, she inserted a heart that she asked the nurse to tape to the window. Well, this seemed innocent enough, so the nurse obliged and taped the hearts to the outside windows to hopefully brighten the patient's spirits. Well, one day, one of our nurses who happened to know this patient's wife walked out to the parking lot and noticed that she was parked next to her car. So she went over to say hello and catch up. And as it turns out, his wife identified where her husband was located in our facility by the many hearts on the windows. So once she found out where he was, she would come out every day and sit in our parking lot and quietly just sit out there and longingly look at that window. And then after a while, he grew stronger, and when he was well enough, they made a deal, and she would call her husband, and then nursing would help him get to the window and look out and wave to his love in the parking lot. Now, that's an example of the behind the scenes. That's not on a profit and loss report, but that's a value that nursing provides to healthcare. And I fully recognize and I appreciate the fact that many of you worked more shifts, you worked for longer hours, you worked in more departments than you knew existed in a hospital, and sometimes short on help because you cared and the need was great. And I realize that sometimes it was overwhelming. And yet you had to still deal with the day-to-day stresses that everyone else in our community was feeling. Like who would watch your children now that day school is closed? Should you go see your elderly parents and grandparents and possibly spread the disease? How in the world are you now going to add homeschooling to your busy schedule? And are FedEx deliveries really safe? Will Walmart still have that toilet paper when you get off of work? Let me say this without an intended disrespect to any other healthcare professional. Nurses are the backbone of any healthcare system. Let me say that again. Nurses are the backbone of any healthcare system. And they are the only healthcare professionals that stay with their patients 24/7, every day, every night, every weekend, every holiday. You're often the first smile that any infant sees, and you're the last hand that elderly people hold. You bring hope and courage to those who have lost it. You bring respect to those who may not deserve it. You give comforting support to those who need it. And I realize that as a nurse myself, I may be biased. I do acknowledge that, but I will not acknowledge that I'm wrong. Just because I'm biased doesn't mean I'm wrong. I've seen with my own eyes, I've seen with my own ears, I've heard with my own ears the stories of your heroic efforts, your creativity, and your passionate deeds. So I came tonight to recognize and to commend you. And I want you to know I thank you and I appreciate you for all that you've done and for all that you've given to your patients in this community. You are my heroes. And I stand in awe and honor of the greatest profession to ever walk this earth. That's nursing. So God bless and keep you as you continue to serve. Thank you.
Thank you, Arlen. That was incredible. As I said, somebody else that could speak from what was seen from inside, those stories, the commitment, the passion. You definitely brought that out, and I thank you for stepping up and sharing that with us this evening. So we're going to move forward to the meat of our program and acknowledging the honorees this evening. So you'll see that they'll be awarded a nice certificate, which they'll pick up when we go through the roll call here. So let's move forward and honor those individuals this evening. So Reader's Choice, our first honoree. So this is the nurse that the community as a whole, when we went through the voting process, the one that got the most engagements, the most votes. So congratulations, Tiffany Browning, Minidoka Memorial Hospital. Yeah, come on up. So we'll just have you come up, grab your certificate, and grab a goodie bag. And then you can definitely do photos and stuff with your family afterwards. So, yep. So thank you, Tiffany. Next we have Bayleigh Coronado. And please be sure to look at the slide. So Bayleigh is with Heritage Home Health and Hospice, and be sure to check out everything up on the slide. So, yeah. So wonderful things to say about each of our nominees there. Next we have Buffy VanSickle, Autumn Breeze Assisted Living. Congratulations, Buffy. Next and unable to make it this evening is Conrad Merkley. So Conrad's with St. Luke's Magic Valley Medical Center. So thanks, Conrad, or congratulations. Next up, we have Emily Stone, St. Luke's Magic Valley Medical Center. Congratulations, Emily. When duty calls, we just had an emergency call in, unable to make it this evening due. You all serve other family members, and this nurse, Nikita Starley, with St. Luke's Magic Valley Medical Center, got called away to a family emergency tonight. So we hope that's all going well, and congratulations, Nikita. Next, we have Ryan Sharp, St. Luke's Magic Valley Medical Center. So congratulations. Also not with us this evening is Samanthia Warren, Department of Health and Welfare. So congratulations, Samantha. Also not able to join us, Jamie Montreal, St. Luke's Magic Valley Medical Center. Congratulations, Jamie. And last but not least, Kassidy Moon, St. Luke's Magic Valley Medical Center. Congratulations, Kassidy. All right, let's congratulate everybody up here this evening. We have a great group. I know that you've all experienced a lot, not only in your career, but the last year. I'm sure a lot of what was spoken and shared this evening are things that you've laughed and cried about over the last year. Again, as we kind of looked at the overall program and what we could, talk about this evening, you look at the lessons learned and kind of, as Arlen said, the profession changed forever. It's never going to be the same. And what's that look like moving forward? Well, we're honored to be hosted this evening in the CSI facility, and finding that next generation of the workforce and recruiting folks in and finding the people with the passion that can step in and do what you do and follow that calling is incredibly important to our community. It's incredibly important to the profession and the future of healthcare. So with that, CSI has put together a video that I'd like us to watch, and we'll see what they have to share.
I think it's definitely a good opportunity that we're giving these people the chance to get their COVID shots, and it's a good opportunity for students to be a part of that as we are giving back to the community. I definitely think it's going to be better because students weren't coming to class, they were doing Zoom. And it was definitely hard because you didn't get that hands-on learning, you didn't get the in-class responsibility of being in class and like having that relationship with your friends and peers just because they didn't want to wear the masks. So I feel like it's a good opportunity that we're giving these shots for the mask mandate to be lifted eventually.
I want to become a nurse because when people come in to get healthcare, they're at a very, very vulnerable time in their life. And if I can be there and make them feel more comfortable, that's what I want to do.
So I live in Haley, and I make the commute to CSI because it's worth it. You know, I want to be a nurse very badly. I want to help people, and our society needs nurses more than ever now.
So we haven't had a pandemic like this since 1918. And so yeah, we're breaking through history.
Okay, so with clinicals, we haven't been able to go out in the field as much, and so we've been able to learn in sim, and when we do go out in the field, because they're starting to let us now, it really teaches you patience and learning to communicate with the people and be able to address their needs in a timely manner.
Yeah, so we're all thrown into this program, and it is an intensive program. We're spending a lot of our time on it. It's like a second full-time job between just school and clinicals, and we are a tight-knit group because we know each other's struggles, and they are sometimes the only ones that understand what you're going through, and so it is great to have them, to call them, or to message them through Messenger even, and it is a nice support group, and we support each other a lot.
I like the critical care aspect. I like critical thinking. I get bored easily, so I like a change of pace. I like to be busy all the time. I don't like any slowing down, really.
All of my instructors have been amazing. First semester, both of the instructors I really enjoyed. They're both really upbeat and they really kept us on track. And then this semester, I had 2 more instructors and both of them were completely amazing, very knowledgeable in what they were teaching.
When I graduate in December, I am already a CNA at St. Luke's, so I plan to apply for a registered nursing job at St. Luke's and work there for however long. After I graduate, I'll work at St. Luke's hopefully and continue my bachelor's through ISU, which I hope to complete in May of next year. And after that, I just plan to keep working, keep making money, and just keep giving back to the community as much as I can, volunteering and just working with the community and the patients and the people.
Well, I think we can all agree we have 2 incredible partners that have helped us share the stories tonight with St. Luke's and CSI. You know, with CSI closing us out, they're, you know, really looking at that next generation and the future workforce in nursing and looking at our community. I mean, one of those students right there, I mean, here at CSI, wanting to go to St. Luke's, you know, stay within the community. You know, as a part of that, you know, from an in-person event and a virtual event, one of the things that is a benefit and outcome of this for us is that in the past, if we had an in-person event, we'd be able to bring people together. The people that hear these stories, saw these videos, heard Arlen talk about his perspective and the incredible things that he shared. And of course, seeing these great individuals on stage, you know, we bring that all together and we're able to share with more people now in a virtual space. So be sure to share with your friends and family. This is something that, again, is vital to our community. We want to be able to share these stories. Go to magicvalley.com/nurses. Be sure to check out the videos. Again, I know that there's extended family, those beyond those that are here with us tonight. Make sure if there's somebody that is doubting what you experience and what you see and what you go through, say just check out these stories right here. I think it might make you think of things and look at things a little differently. So that being said, I want to thank my team and the staff that helped us put this together. So I've got a few of you in the seats tonight, and others that helped us along the way. So we're in a great community. We have great nursing backbone, as Arlen said, of our medical infrastructure here. Let's support those in our community. Let's tell the stories. Let's continue to celebrate everything that you do, the passion, commitment, the 24/7 obligation that you bring to our community. I thank you so much from the bottom of my heart. I thank you all for coming here tonight. And with that, I bid you all a great evening. Thank you. And for those, we're kind of cut off live and all that. If you want to come up again, get some pictures. We've got Drew here. We'll be happy to take some pictures and have those moments. So thank you again.